Yeah, life is fantastic, man.
Are you like, your working day? Like, I mean, it's obviously a very unorthodox sort of working lifestyle. I assume you don't probably wake up and go, I'm going to read my coffee and read the newspaper. At 9 o'clock, I'm going to start. It's like you kind of just start and you finish whenever you finish, right? And
Totally right, man.
so how's your day kind of go, anyways, as a professional physiotherapist slash online guru?
How does it start? 9 o'clock. Try and make sure I get something up on Instagram. That's about one plan.
Is that real? Are you being serious there, or?
Yeah,
Yeah,
that's a
wow.
serious thing. It's that you try and get something up by about 9, and
Yeah.
then turn around and go, "Fuck! I'm trying to write a lumbar spine course that I'm going to be putting out at the moment, and there's just so much editing in it. Like I was up probably midnight last night, going, shit, this is really good. Now I've got to cut and paste that from where I had it to a better place.
Yeah, yeah.
So one of the things about teaching is just like that, because the skill to it is to actually get people to understand, not just dump information. And sometimes you realize you've got an information dump there and yeah, it's good, but no one's going to get it because they'll just be too overwhelmed. So your skill is you got to go, I've got to cut that, I've got to put it somewhere else so it actually flows better. And that's a real tough thing.
I mean, like, we've had the pleasure, obviously, seeing you live in person, having a dinner with you, and having just to chat with you like this. And it's like you really do have this bit of a knack for simplification. And you talk in, we were just talking about it before, you talk in a lot of analogies, or you will make reference to like a historical thing, or you will make reference to something else that's got nothing to do with the topic that you're trying to talk about, but it'll make sense. Talk us a little bit about that. It's like, is this just from like years of reading stuff, or how does this process work for you?
Oh, man, you nailed it. That's exactly where it comes from. It's like I see half-wits on Instagram, right? And they've seriously just graduated.
I
And
haven't
they'll
even
go,
done that.
there's no evidence on the subject. And you just go, really? Fuck, 30 years later down the track, I'm still reading more about the evidence, but somehow you know that there's no evidence and you know everything and you just graduated.
Right.
And so the backup of that is, how do I get there? That's because I keep reading shit. This morning I read a fantastic thing. Here it is, Easter, right?
Right.
And one of the things Jesus said was about the Pharisees and the scribes was, you try to strain a gnat, but you swallow a camel. Now, essentially what that means is you're picking over little bits of shit, but you're missing the whole point and you're swallowing bullshit. Get the bigger picture.
Interesting.
That's a skill in itself.
Is this from the Bible? Like, where are you reading this
Oh,
text
yeah,
from?
where'd you
Like-
read that?
Like, where did.
That is in the Bible, yeah. That's when Jesus is addressing the Pharisees and the scribes.
So you're telling me that it's Easter Friday, right? So you wake up this morning
Yeah.
and you're like, it's Easter. I'm going to open
Wait,
up
no,
the Bible.
You're a pastor, isn't
he's-
he? A pastor or a
He
priest?
is.
I
qualified.
am the Reverend, yeah.
You're the reverend. So
So by duty, you should be reading it anyway.
I better know my shit, yeah.
the reverend that drives Lucifer.
I think, because what you've kind of said there, it's like knowing the language, right? Like understanding language and how it's used, because you can really then understand it. Because that's something I guess I struggle with when I read papers. I'm reading it for the first time and I'm just like trying to figure out what exactly do those words mean? What kind of story are they trying to tell? Like, is that just, again, years of experience, or, do you have a knack for language?
You figured it out, man. I often read a really new paper, perhaps it might have come out, and it's on a subject I know a lot about, perhaps, and I'm reading it and I'm going, there's some terminology in here which I've got to look up. How is anybody really, really absorbing what's in here? And that quite often happens, that you get things that are quite deep and so far in depth that it takes a lot to get through. So yeah, you're right. The language and the ability to not try and make out that you're the smartest guy by making sure nobody can understand you. It's make sure that people understand you and they like it, they get it.
Yeah, because this is a segue, but we're talking about like how you're so positive and stuff. And I think I was chatting to Louis this morning about like, maybe clients or people in general that we work, and they kind of don't want to be helped, right? And you kind of want to whack your head against the door because they don't want to be helped. They're not trying to like feel their stuff out. How do you get years of doing physio and stuff, like frustration of that? What do you do?
I don't get clients that don't want to do the work.
There it is.
Touche.
I like that.
Simple answer.
If you're going to charge someone $500 an hour not to take in the message, that's their problem.
Yeah, that is so
Seriously.
true. So is that the fix then? Charge an exorbitant amount of price, so that way that whoever's coming to pay that price is going to listen?
Actually, it's a really good lesson for someone to learn too. because you might want to help the world. You might want to save the world. And you decide that, you've got a lot of people who can't quite afford your service. And so you do some freebies. You want to know the patients who aren't going to turn up for their appointments? It's the ones who you've just given the freebies to. They don't value your service. You just told them your service is worth nothing. And that's pretty much the message they get too. So no matter how good you are and how kind you are, sometimes the message is going to have to be related to value. And the clients appreciate that too.
How early on in your career did you start? I mean, obviously being in that space from the outset, you could already charge a pretty decent price, right?
Mm-hmm.
Did that price kind of increase over time, or did you start at a lower rate and over the time kind of increased your rate? How did that process work for you?
One of the things is, of course, I started working for somebody else, because when you first come out, you're going to have to work for others because you've got a lot to learn.
Yep.
And so, for example, I think I was on a 30% rate maybe of whatever the billing was. So I was going to get 30%. Work at a footy club. Seriously, I worked what we would say is 14 days a week in the early years. Because you're doing your normal job, but then you're off to the footy club every freaking night, a different footy club maybe, and you've got the weekend where you work in the morning, and then you go to a club on a Saturday, and then you go to a club on a Sunday, and it starts again. So you're really digging deep. You're not getting paid a hell of a lot per hour, and you're doing a lot of hours. Mm. And eventually it gets to the point where, of course, look, I was lucky. I was already known before I was even a physio at the time. So I was getting patients who were being sent to me before I even graduated. It was quite amusing in some of the hospitals. People would try and book in and see me. And shit, I was in second year.
Yeah.
And so I already had a name that people knew I understood weight training, and they were the ones that were wanting to see me. So pressuring up from that sort of thing is you've only got so much time. So you start to charge according to the rates that your time deserves. And of course, when you spend probably a few $100,000 to freaking, who knows, probably $1 million of your own time in research and buying books and going to courses and traveling the world, you better recoup that sometime, because you made a monster investment in everything.
And you better consider inflation as well.
Yes. So start digging in deep, because you deserve it. You've paid the price. Someone down the road who hasn't done as much work as you, well, maybe they are going to charge less. Mm-hmm. But you've invested in yourself. You've invested everything. Mm. You might have even bought freaking offices. You might have bought premises. There's a lot of investment in it. So if you're really there, you've got to charge to cover that. And for me, it's the intellectual charging. Yeah. I've done my work, and I spend my days from morning until night doing more work. Yeah. At the end of the day, I'm going to charge for that.
It was a breath of fresh air when we spoke to you, and this was during the dinner, and you kind of, I wanted you to say that you need to find a balance and stuff, and then you were like, no, you've got to work hard. You've got to sacrifice, because, we're tired and we've got normal jobs in the afternoon and stuff. And then when you said that, I was like, you know what? He's right. You just got to keep working, keep sacrificing what it is you want.
And sometimes it's not you who sacrifices, it's everyone else around you.
So going back to when you were still in your second year and people were still lining up out the door to get into with you, why did people already know you back then? What was the impetus to that?
Let's see. I've had a bit of obsession with the weight training world, and I was lucky enough that I was getting reasonably big, and I was sort of thinking about competing in that sort of area. And I was related to the IFBB at that time just through working with, at the right place at the right time. I was the guy who picked up the pros from the airports and drove them around to wherever they had to be. So I was in the gym with the pros. I could look at Dorian Yates, Lee Haney, Sean Ray. So I was back with these guys who were, this is the 80s, Yep. And I was getting to hang out with these sort of people. So I was getting associated. I was the guy who took the money when they were signing the photos. So people knew me as being related with the pros at that time. And then I became a judge because they needed a judge one day. So, it's nearly 30 years of pro league judging. So I was always there for people to ask. And then, of course, I did my physio degree. So they knew that he was a professional who was already well and truly in the industry, and knew what a bench press was, knew what a deadlift was, knew what a squat was, knew what it was like to have constantly sore elbows. That was what we all did. And so they knew they could talk to me about this, because it wasn't like they were going to go to the local place who maybe the practitioner played a bit of golf on the weekends, or maybe ran marathons like most of the ones I knew did.
Boring.
I was unique at the time. Now, the beauty is the professions are opening up beautifully and you're getting new grads who are coming in who have already lifted weights. And I think CrossFit's done a lot of good for the world in that style of thing, is it introduced people to going to weight train who didn't realize they were going to the gym because they were people who wouldn't have gone to a gym. It opened the community up, and from that community, powerlifting grew greater, Olympic lifting grew greater. And now you're getting people, of course, who are going through courses now in all the health professionals that have already lifted weights. So it's a really good thing for the industry.
Although CrossFit did a lot for the industry and got everyone bigger, do you reckon they also did a lot for physiotherapy industry and gave heaps of work?
They might have given heaps of work to the physio industry, but did the physio industry do much to help?
Yeah.
There are very few physios who are competent at that time too. And now there's some really good ones who are competent, actually, like Ben Lustig. I love his work. He's got a CrossFit place in Moreland. Well, there's a physio who actually runs a CrossFit place. Brilliant.
Yeah.
We're getting more of it.
How important do you think it is to practice what you preach? Because, you're in the weights room and you get people that are referred from the weights room. And if you've never really practiced that kind of stuff, can you really help them?
It is tough, but as the more experience you get, the better you're at it. This morning I was working with a rock climber. Now, you'd think I could climb a rock.
We've met you in person. I don't think you're very good at rock climbing.
People can climb me maybe, man, but I ain't climbing a mountain. But what it comes from for me is it's movement analysis. So I look at the skill and I go, yeah, that's sure. I can show you how to use your abs better in that. I can show you a better position for your hip flexors that you can use for strengthening. And they pick it up straight away and they go, oh, this is great. It's exactly what we were missing. Well, that's movement analysis. So, yeah, as long as you understand movement, and I think weight training gives you movement analysis that's a basis to all sports, really. I mean, you're going to weight train and do tennis. Shit, you can probably do weight training for golf if you want. It's okay. If you want to play darts, you could probably do better if you do a bit of weight training. So weight training is probably a useful thing for every professional to do as a basis to be able to do other things. It's like having to work with you guys. Yeah, what did we do the next day? Shunt myself, we ordered ourselves some packs. Yeah, fantastic.
Yeah, you saw that on his Instagram. Yeah.
So I just want to go backtrack to a few minutes ago when we were talking about the social media posts that you do every morning. I believe...
Yeah.
What?
I was literally about to say that.
All right. Do you want to say it or a minute?
No, you go.
Now, please don't take offense to this, but I believe your generation are called baby boomers. Is that right?
I don't know.
What's your generation called?
No, I'm not part of a generation, man.
Yeah, that's what's up.
I love that.
Let's just go back into, I don't know, people that have been around for some time, right? Instagram is not their first point of call, right? But you're obviously quite prominent on it. How was your attitude towards Instagram when it first started coming out, and as a professional running a business, trying to get noticed and seen and get your name out there? How did you go about this process?
I didn't. I stayed under a rock and, used my club to beat fucking dinosaurs with, man. I wasn't into social media at all.
Yeah.
I'm a caveman. But I'll probably put out some bigger educational content now rather than just, hey, people want to see something. So the major switch to me really is, it's like what I love Sebastian's doing with Australian Strength Coach. He's upping the educational level now so much better and deeper, and the quality of the work is so much better. So it's moves now to the point of actually you're just trying to educate, and that's a platform we use. I'm not going to do any TikTok dances. You get fucked.
Can we see just one?
Just one.
TikTok's ruthless.
A lot of people on Instagram, or even just in the social media stratosphere, just complain about social media not being an appropriate medium for education. But you're now talking about educating on social media. It's like, I believe you probably have some harsh things to say about it. What can you say about that?
Well, that's the thing that we know. Social media doesn't have a filter. It enables somebody with no experience at all to say anything they want with great authority. There's the only problem you got. Now, if you want to go follow them, that's your problem. I'm not going to really try and convert you to anything. It's your business. People with an ounce of intelligence will follow me, and other people like me who actually put out work that's fairly discernible that you can work and listen to, and you can apply to your endeavours. If you get some skinny dude out there who's trying to tell you how to lift weights, and he's fairly good evidence that he doesn't know what he's doing because his body's showing that whatever he's saying doesn't work. So don't follow.
Are we thinking about the same person?
Probably.
Yeah, all good.
Often, don't worry, there's heaps of them out there. I look at that from a social media point of view as seriously look at the individual who's presenting the information. Now, it doesn't mean that you're taking it on the fact that they look good, what they're saying is truth, but it's going to give you a little bit of an opportunity to start to investigate how they're talking about what they're doing. And of course, you want to talk about showing your abs and saying that you eat clean and really you're taking a whole bunch of gear. That's a different world altogether. That's not what we do. I'm just talking about medical science.
Mm-hmm.
Yeah, I'd steer clear of TikTok if I was you. it's fucking.
I don't have time, man.
It's a nightmare. It's even worse.
I can see the three. Of you do busting TikTok wide open, man.
Oh man, I struggle with social media so hard. I just go through back and forth this relationship. But I've tried. I continually go back to it. And it's like a chance for me to present what I know. And it's more like the people that we follow, like yourself. Many of the people that we follow, they follow us. They don't really know about you, and so it's like we're the medium essentially to guide them to who to really listen to. That's how we see it.
Yeah, we don't need to push it. The people will come there organically. I never bought a follower in my life. I'm not interested in that. It's not about the numbers. It's about the quality of the people who you're engaging with. And really, that's beautiful. If we've got a wonderful audience, there's so many around the world, look, we're already overfilling it with people who are interested in the good work.
Yeah.
And there's more. That's great.
When you first sort of started out on Instagram, like you said, you never really had anything to do with social media. What did that look like? How did you start? Did you start straight away and you were like, oh, I'm actually enjoying this, or is it still seen as like a chore? Because you say you do it every day. Like I hate doing it every day.
And how did you find Wi-Fi in the cave?
I had a good cave. Had aircon. Yeah. In the early days, you sort of probably trying to be a little bit authentic and genuine about who you are. To start with, perhaps it's more about a little bit about yourself before you move into being comfortable present what you know. So that would likely have been my earlier stuff, would have just been, hey, I'm over here, I'm over there, I'm eating this, doing whatever, and this is me, for people who are just a little bit, now he's on social media. And okay, after that, then you start putting some educational work in, and it's probably not that really well curated. It's just that looks interesting. I'll stick that up. Maybe someone will be interested and might help them. And now it's probably a lot more contextual. I think the biggest thing is there is a bit of a good move, I think, towards social media moves so fast. What I'm starting to see is people are starting to accept the fact that there is more to context of every post that gets put up. And that's where I pretty much put in all my work is this is contextual too. The context of this is. Because if you don't put context up, then all the angry ferrets out there just start jumping on it. They're the ones who are trying to strain the gnat and they're swallowing the camel. That's exactly what that comes down to.
I love that. That is absolutely right. And that's probably the hardest thing about social media. Trying to make it contextual. The ability for people to actually stay intrigued and interested on what it is that you're saying, firstly, has to be extremely, extremely visually appealing to some degree, and it's got to do something to make them either curious or worried or something, right? But then you've got to provide a very, very specific sort of context, and I just find that to be so hard. I don't know how. Yeah,
it won't take you long. Once you do a few of those, you'll start to really nail it. You'll start to realize that when you're talking about this, it might be if I'm talking about my patient population. I often say, I've got a biased population. I work with people who tend to lift weights, tend to understand weight training. They're an athletic group. It's not really your gen pop so much. So perhaps the results I'm going to be giving you relate very much specifically to the population that I treat. I think that's reasonable. You might treat a very different population. And what I do may be a little bit too perhaps advanced for some of your population groups. That's cool. I like to make sure it's a little bit clear that I'm not talking about I treat everybody in the world. I treat a particular style of person.
Sort of segueing off a little bit, going back to, I know you were saying earlier, talking about CrossFit, and I seen you just did a workshop at a CrossFit gym.
I believe you about to say you did a workout.
and potentially others in the past, I'm sure. Going to that population, what's something that, I guess from your experience going to those gyms and working with those people and that demographic, what's something that you potentially see as a population that they're lacking in that they could hone in on a little bit more and work on?
Well, I don't spend a lot of time in that population group either, so it's probably a little bit, I don't see a lot of them. But the ones I am seeing, I think there just seems to be so much better coaching in the last 2-3 years of CrossFit. What we used to see is so different that's coming up now. I'm seeing a lot better technique, a lot better movement analysis. There's actually just be better people coaching in it now.
Mm.
So as far as what I see now, I see a really good approach to technique matters more than just fail on your deadlift, which used to be a little bit what seemed to dominate the early days was, go hard until you fail. I just don't hear it that much now. I think there seems to be a lot better, at least within the groups that I see, that they seem to be very technically competent and like to do a lot of different things. So that's pretty good.
Yeah, no, cool. Yeah, 100%. Like, I've definitely seen that. Looking back to when it started, it was 100% that mindset of we need to go max effort in everything. And it's something I've had to sort of pull back a few of my athletes on and have that discussion. But it's definitely getting better, right, for sure.
I would have probably seen about 4 to 5 post-disc surgeries, post-deadlifting at CrossFit in my early years in practice when CrossFit was starting. I haven't had a single one in the last 2 years I can think that's come across that's actually had that scenario. Deadlifted to failure, did my back, had surgery, now seeing me. So there must be something changing because I'm just not seeing that come through the same way anymore.
You're generally referred with the spine and stuff. What led to the infatuation with the spine?
Oh, the infatuation with the spine. Everything comes usually from personal experience. So, my joy was when I first graduated, the best piece of advice I was given. I was pulled into the office by the person who ran the clinic, and she was a pretty wonderfully intimidating human being and academically deserved everything she demanded. And she said, now your job here is to become the best in the world at something. And she looked at me and said, I'm the best in the world at shoulders, so you've got to do something else. And all right, so that meant what were we the most shit at when we graduated? Well, it was usually spinal work. So another guy and myself said, okay, we are off to get better at spine work. So we signed up with the Mackenzie Spinal Institute and did their complete program. And we got in at the right time when they changed the rules. Normally took a few years to be allowed to go through. And we completed the program in 1 year. It was awesome. I did my exams over in Madison, Wisconsin in the USA. It was an awesome experience to sort of go around the world even to do further work. I did functional capacity evaluation in spines. I was even thinking I was heading towards more that insurance style work where there's a lot of psychology and behavior also in the work. But I got drawn back to Australia and back to lifting weights a lot heavier again because I pissed my back off and totally exploded my L5 S1 disc and there was nothing left of it to deal with. Took 2 years to walk properly again. Welcome to the best experience you can have as a professional. It's the gift of injury. And so I became very obsessive with back problems, and that was the focus of my work was what is the mechanism of how discs resolve? And I did that at Melbourne University. So I got a little bit obsessed with spines, and it still has never left because even now, I moved more towards the evolution of how human beings evolved. Why do our spines differ from the rest of the primates? And we are different. That tells us a lot about how we move. It also tells you about why posture can matter. It tells you how lifting can matter. It can tell you how different people move because of different spinal shapes. Now, all that's not taught at universities, but it's all academic work that we should understand. Realistically, I think if we want to redesign a physio, chiro, osteo course, I think it should have basically evolution and functional anatomy as a cornerstone of a couple of years of work. We will graduate people who actually understood that everything we do is based on science. The worst thing in the world is this concept called evidence-based practice. Yeah, well, you know what? Your evidence-based practice gave us transverse abdominis multifidus co-contraction theory, which was total bullshit. Your evidence-based theory gave us VMO retraining, which failed. That's evidence-based. There's your evidence-based practice. How do you know your new evidence-based practice ain't a bunch of bullshit either? Well, you can do it by going through the fundamentals of science. Understand your anatomy. Understand your physics. Understand your kinesiology. Understand the biomechanics of movement. That's not evidence-based work. That's science. And guess what? You didn't learn it at university. And that's the terrible part of it. You might have passed your exams in anatomy, but I was teaching a group of final year physio students who are doing their doctorate, and I asked them, can anyone here tell me what is this muscle that has the single biggest influence upon lumbar lordosis control? All right, not one of them could answer that question. How the hell do you graduate a bunch of professionals who can't tell you what the most important muscle for lumbar lordosis control is? That's the failure of the academic system. And they're all coming out saying, yeah, we do evidence-based research. We do evidence-based practice. shit, you don't even know your science. It's terrifying.
It's frustrating because it's almost like at the pace that they're wanting to you learn. I always say this, like we study to pass and not study to learn, and it's a frustrating process because like I'm now going back through all my anatomy. I've got my colouring book, thanks to the recommendation. But again, because like you guys talked about as your currency, but it's so important. I'm redoing that, finding my way of learning, right? Because the way they were teaching me was to just kind of rote learn, and that's not how I learn. So I need to understand. And again, I enjoy it, but a lot of people finish their courses and then they're ready to just go into the world without even knowing much.
Well, not all of us have the same drive to what to actually understand. And that's a passion that perhaps you and I have. We want to understand. A lot of people perhaps don't really care about understanding. If you remember, one of the biggest statistics about back pain is 80% of all people with lower back problems get better in 4 weeks, regardless of the intervention. Well, that means if you're a professional, you've got an 80% success rate just by they're walking in the door. Doesn't mean you're any good because you've got an 80% success rate. It means human beings heal. The success comes from your analysis of the problem and stopping the 92% recurrence rate that occurs after the 80%. And that means you better know your shit.
Yeah. You just said the word pain and it kind of just like rejogged my memory. Can we talk a little bit about pain and discomfort and differentiate the two there? It's quite a common thing, people will be training and they'll experience a niggle anywhere in the body, especially around the lower back area, and people get very, very hypersensitive around it and get really, really worried. And it's always kind of like a battle to kind of try and ease their mind and change their perception about what's actually happening, why it would happen, how we can resolve it, and all that kind of stuff. And can you talk a little bit about that process there of how people can distinguish between pain and discomfort a little bit better?
It's a very it's the thing about that's cognitive understanding more than anything. It's more comes to behavior. Remember, I'm a physical specialist, less than a behavioral specialist. So when it comes to discussing pain or discomfort, pain I tend to look at and discuss with a client upon the idea pain is that thing which you can't very well control. Discomfort is that thing you can control. If you stop, it feels better. All right, so now we're dealing with something that as a result of what you're doing, it actually seems to settle pretty quickly. All right, so that was uncomfortable. Pain's that thing that, not a lot you're going to do with it that you're really making a big change with. That's where you cross in the line perhaps into a definition of pain we could play with. But I've done behavioural work since I think about 96, and it is a fairly complex thing. And I always say that it's almost like people are saying that they've discovered that human beings communicate. It's just like this the physio thing I see now, it's the way you talk has an influence upon your patients. Oh, fuck, of course it does. You learned that in kindergarten when you talk to your freaking kindergarten teacher. You learned how to get through your high school by being able to talk to people. You ordered your freaking lunch from the lunch lady and you knew how to make sure she was happy about it. You don't talk, crap to a waiter who might spit in your food. If you haven't learned how to relate to a human being, what are you doing in the profession? It just sounds to me that people are having to emphasise the fact that, you need to think about this. Seriously, you should be able to do that second nature by now. You're supposed to be a movement specialist. It's frightening that people seem to think that they're suddenly learning how to communicate. Shit, of course you know how to communicate.
Do you think
maybe how a client feels?
Do you think maybe that's where the industry kind of got a little bit lost, where they ceased to understand how to communicate with humans?
Fuck no, of course they always knew how to.
Yeah.
Jesus, if you didn't know how to communicate, you wouldn't have got to uni in the first place.
Yeah.
So what's your recommendation? Say you have that fresh uni student who's just finished their degree. What would you suggest is next in your experience?
Lift.
Follow your passion. What is the thing that drove you to enter the profession in the first place? Now devote yourself to that. It's very easy to get distracted by a lot of things, but what was the first reason that really made you want to do that profession? Now, there might be some people who said, hey, it's money. I want to make money. All right, that's your deal. Go and do a business course, learn how to run clinics. Cool, that's why you do it. Other people like myself, it was more that I actually like helping people. I like seeing people get better. I enjoy being part of the process that someone felt that I'd helped them. That's why I do it. I only do it because I like to help people. It's not all about me. I do that in the gym. That's all about me then. That's quite cool. I'm happy to be all about me then. But if I'm in the practice, it's all about everybody else. It's not about me.
Yeah, I like that. I want to ask one very particular question. That is the appearance. You obviously, if someone was to see you, they're just like, wow, this is like a very unique individual. The haircut, the beard, the chain, and just the look, right? Can you tell us a little bit about how that existed? How did it come to fruition? Why? Who is that?
You go deep into my psychology now.
Yeah, this is where we want to
We're
go.
going deep. We're halfway in. We're going to start.
We're going real deep.
Yeah, you go deep. All right. Essentially, I always was going to be a professional athlete. That was my goal in life, right? Now, it was about third year uni, and I was approached by someone to become a professional wrestler in America. Now, at that time, let's face it, I'm around about 130 kilos. I got long blonde hair, and I was reasonably imposing. And I liked the idea of being a professional wrestler. I used to watch it on TV. So I was a little bit heading towards a professional wrestling life. I enjoyed that. They were always distinct characters. Now, that probably just led to me being a little bit more distinct in who I was. And it evolved into simply, I had a mohawk from pretty much the first day I graduated. Actually, I'll give you a bit of a run. I was bald when I graduated.
Was it
an
that
interesting
bad?
experience. Well, what happened was this. I had the long blonde hair up until the final block at one of the hospitals. And there was a particular supervisor there who was well known for the fact that she had a rule. Out of 3 students who come in, 2 pass, 1 fail. Didn't matter what happened. It was a 2 pass, 1 fail rule. Now, this is my final clinic of the year. You fail that, you're coming back next year. I was not coming back next year. I also looked in the mirror. I thought, yeah, I've got a big chance I'm going to go because I'm 130 kilo, got long blonde hair down to my ass. I'm probably going to stand out. I've got to do something about this because she was known to be a fairly small, tough older supervisor. So the day before the clinic started, I shaved off my hair and my eyebrows. I thought, what this will do, she will not know whether I have something particularly wrong with me as a human being. Am I suffering from anything? And he will throw a curveball into the mix. And
Maybe she'll feel bad for you.
This is possible. This is what I'm talking about, human communication, understanding people. I know this person fails 1 out of 3. And I know, looking at what I look like, I'm probably going to be it. I'm going to change the game. So the eyebrows went, the hair went, and I walked into the first day of that clinic, and the 3 of us were there. And sure enough, I got looked at first, and the look on her face was, I don't know. Just tell. The next guy, he could blend into any movie as a background extra. Totally grey man. Just you wouldn't recognise him anywhere. Sure enough, she didn't know. He was nothing. The next guy, sure enough, he was of an ethnic minority. And I saw the look on her face, and we all 3 of us knew at that particular point, you're gone. And that was exactly how it was. I got a killer easy exam. He got a brutal exam. And sure enough, I passed. Yeah, wow. That's where it goes. So that's why I got rid of my hair. No,
I love that.
That's knowing the people you deal with. Yeah, so after that, I just went to the Mohawk and enjoyed it.
So it's all about kind of almost creating, is it creating a persona, or is it just, I don't know, or is it just what you like? Well, you like the white beard and the white mohawk and the big chain, I don't know.
Here's a thought for you. Is Batman really the real character and he's pretending to be Bruce Wayne, or is it Bruce Wayne that pretends to be Batman? Now here it is.
Matrix.
We're going deep.
Yeah,
are you prepared for this? Also, where do you get the chain from?
Oh, that's a deep one. It's a classic.
You don't go to Bunnings. Do you know how they got those rollers at Bunnings that you can just roll chain or
especially made.
The real question is, do you sleep in the chain?
Only if I'm a couple of bottles of bourbon down.
I love that. That's good.
But yeah, we should start merchandising the chain. We'll start doing something about that.
Oh, man,
that's a good idea.
Definitely should.
I think why not?
So Andrew, the other day we put up a little box on our Instagram, and we'll just throw his phone numbers in here if you want to get caught up live on the podcast, and you can ask Andrew a question yourself. We have had a few responses. I reached out to most of them, just asked them, hey, what it is that you want to ask, and just obviously vetting it, make sure it's appropriate and whatever else. and we there is a guy that we want to call. Obviously, if you're willing to do that.
Oh,
Yeah.
Certainly can.
But-
I look forward to anything.
We're creating. This is the first here in Australia.
First time you've seen this on a
Yeah,
Yeah,
podcast.
for it.
seriously.
Let's hope it works.
So I won't tell you what he's going to ask, but we'll just kind of let him roll.
Yeah, let the man come.
Here we go.
Come to the mountain. Come to the mountain, man.
What are you drinking? Is that coffee or Monster?
That's a protein drink right now.
After seeing you drink the Monsters, we got
Is it
addicted to them.
Ryan? Ryan H.
Do the monsters.
Yeah.
Oh, they're good.
Yes.
They're good.
All right. Cool. This is we're going to call Ryan. All right.
All right, Ryan. Pick up Ryan. Do us a favour,
Hopefully
mate.
it starts. Yeah, there we go.
Yeah,
Rock on Ryan.
Hopefully he answers.
Come on,
Into
Ryan.
the lion's den.
Ryan, this is
Come
your
on,
one
Jimmy.
moment,
This
mate.
is your one
Come
moment,
on.
Ryan.
Shut down Pornhub.
Hi,
Ryan.
it's Ryan here.
Oh my God!
Ryan.
Please leave a message.
No, you know what? That's we tried.
We tried. Oh, we got another one.
Hang on.
Good try, Ryan.
We got the next one. Where is it?
You haven't got to do this. Is so
Yeah,
unprepared,
dude,
Lewis.
Mr. Fella. 04
That was a good try.
Let's go. Let's see if this guy does.
426
We have a crack at it now, huh?
399. All right.
The Pope is currently engaged.
It's all right. I'm
What's this guy's
quick
name?
on the hang up if we need to.
What's this guy's name?
I don't know. Could be failed.
Hmm? Oh, man. It's hard to pick up the phone.
Oh my God! That's it.
You know what?
Failed. The people
It's a
failed
fail.
us.
Done with
all
it. Whilst we're on the question of Instagram, we do have someone, shout out to the Salient Dig. He's one of our army brethren. He's got a question for you, actually. What do you guys describe as the pillars of longevity? He might be asking us, but I'd prefer if you answered that. What do you
I'm
describe
sure
as
he's
the pillars, the pillars of longevity? What are they? Other than the base 5.
Looking both ways when crossing the road.
Pillar number 1.
Eat lots of meat. Don't cook your meat way too much. Cook it, undercook it. That's very good for you. But be passionate about yourself and your truths to yourself. If you want to get rid of stress in your life, seriously, just look inside it. What is the thing that makes you want to be excellent? And apply some serious integrity to that purpose. And I think you'll find you live well. You'll probably find someone who enjoys being with you as well because you're a good person. And be good to yourself. Essentially, you'll probably be good to other people as well. I think realistically, that's probably the most important thing for longevity, is if you're really happy when you wake up in the morning, like I am, you're probably going to be really de-stressed. You're probably going to have a smile, and happy people tend to last a lot longer. I'd really go with that.
I was just thinking, I'm so impressed that you said the word stress, because it's like that is ultimately the degradation of a human fucking body. Stress. Right?
That
So
is.
what do you guys reckon is a pillar of longevity?
One pillar or many pillars?
Oh, give us a pillar. What do you reckon?
I always talked about this, like living by principle, and it's like we live by values, and for me it's like leave the place better than you found it. That's what I've come here to do. I'm trying to leave this place better than I found it.
That's pretty awesome, isn't it? I reckon you nailed it there. Leave it better than you found. That's doing good.
Yeah.
Doing something really good somewhere. And your motivations, well, as long as they're the motivations that motivate you, not somebody else. That's another thing. There's a beautiful book called The Virtue of Selfishness. And it's good to realize that the word selfish is actually a really positive term. It means being true to the values that you have. If you stick yourself out trying to be good to everybody else's perception of good, you aren't going to be around for long, because someone else will always be telling you what you should be doing.
Selfishness is always like attributed with a bit of a negative sort of mystery behind it. And someone like yourself who's probably been quite busy in his life, have you ever been called selfish or made feel like you're selfish?
No one makes me feel selfish. Hell, I don't even have time to contemplate that. We only have so many minutes in the day we really have to devote to the things that are important to us. Let us not devote our time to things about other people's opinions of us. They're useful sometimes to help us learn. It's like if somebody posts what appears to be a dumb shit comment on social media to me, I can often look at that and say, you know what, there's an opportunity there to realize I haven't communicated what I wanted to communicate, and that person is missing something. So I might actually try and do something that addresses their failure. So don't look at attacks sometimes in a negative fashion. Look at the attacks as a gift. you could have done something a little bit better. So can I do that better? Can I communicate to answer that question that they got pissed off about? And they're really useful. I do a lot of my writing around that. I realize if I'm going to teach a course, this is a reasonable question somebody's asking.
Yeah. Well,
I like that, man.
Yeah.
Looking at yourself before you look at others. It's
I never stop looking at myself, man. Seriously,
I think this is probably the most special part about having a conversation with you. And that's why I said to boys, I said, I want to get him on there, but I don't necessarily want to talk about physiotherapy and training. It's just like, because when we had that dinner with you, we realized just through conversations just how historically wise you are, right? You've been around for a bit, you know what I mean? Like, and you have like a very, very certain way of thinking, and it's quite admirable. So yeah, I like it. Very
Thanks,
good.
man. That's just about being authentic,
Because
I love authentic people.
Because a lot of people, and I'm definitely part of the younger generation on social media, and I'm definitely in the loop with everything that's going on pretty much. And like, there's a lot of people out there who throw a lot of flack at people, right? And you've probably noticed yourself getting a lot of flack from people who are completely irrelevant, but they still throw flack at you. And I thought, firstly, there's no need, but secondly, I'm just like, there is something that people just don't understand about yourself in particular that I think through a conversation like this would be like, oh, fuck, you know what I mean? Like, these guys actually got a lot to give, like, rather than just throwing flack for no reason, without actually understanding who you are and what you're about.
Oh, there are always opportunities.
Yeah.
And I had one last week. It was a really good opportunity where somebody made a comment. I looked up a little bit of something in regard to that comment, and the first answer I found on Dr. Google told me that what I thought was wrong. So I spent the next 4 hours finding all the most authoritative texts that could not give me the answer I was after. And then trust me, I was going deep again. So I better go back to Dr. Google again. And, well, you know what the other problem was? It was the first fucking answer on Google that was wrong. Every other answer that followed it said I was right. And I just put the first thing up on the research gate that was a peer-reviewed paper that actually had a mistake in it. Well, that sent me on a 4-hour mission to try and find that I was wrong. Well, that's a positive thing to that.
With that, like, that's a skill of critical thinking. What are some things in mind when you read a paper? Like, what do you think? Do you change your mind instantly on that paper, or have you got questions that you're asking yourself?
The thing about any of these sort of thing about reading research is you have to know your subject really, really well. And if you don't know your subject really well, you're probably just going to read the abstract and the conclusion. So I tend to go to the methods. And as soon as I read the methods, I'll know whether there's a decent conclusion that can relate to it. So, for example, if you want to know whether shoulder activation works and you find a study from Brazil that says shoulder activations don't work, as a conclusion, read the methods. You find out it was using a TheraBand 3 times a week in a clinic with a physio. Well, fair call. But it's not mentioned in the abstract. The conclusion should be using a TheraBand 3 times in a clinic with a physio doing external rotation doesn't improve your stability. Good call. But unfortunately, the abstract just says stability training doesn't work. And that's the problem with evidence-based research, is most people, especially anyone who hasn't spent at least 15 years in postgraduate work, probably doesn't know how to read the methods, probably can't do a statistical analysis. And of course I can. That's the beauty of it. So once you go to it, you can go, yeah, I can see the failure. I can understand why you've made it why you're putting out on Instagram what you think, because you actually don't know how to analyze the statistics, and you certainly didn't read the rest of the paper because you didn't understand it. As I said, there are papers out there I have a real tough time reading because they can be really dense. So it's sort of like, take your time, try and learn. If it seems there's an important point for anybody. If the evidence-based research result conflicts with basic science, I'll bet you the basic science is right and your evidence-based research is wrong.
Touche.
That'll be it.
Looking back to sort of when you first started, like finished university, went out into the the big wide world.
We're going deep again.
We're going deep. Compared to now, sort of how's your experience over the last sort of years changed your mindset towards things? Has it changed and warped massively since you started, or has it relatively been staying strong on a similar course the whole time?
The good thing really was, in the early days, I would do every test known to man and make a few up myself on everything I could do, trying to understand how the tests work and what the results of the tests mean. Now, coming to where I am now, I would have discarded 90% of those tests because I now have other markers that I've developed that are more perhaps precise and give me the information. You could do the other tests if you like. there's no problem with going through them. It's just got a limited amount of time. So do the tests to give you the bang for your buck that relates to your client's goals and outcomes. Sometimes you don't need to do a test that actually doesn't relate to what your client requires. And you need to know all the tests that perhaps your client relates to. So that would be the biggest development, is going from more an approach of I better test everything, but to now being much more goal oriented from the moment the client and patient walks in, to testing very specifically in regard to what that client's goals are. So you become a lot better at being able to have a huge toolkit of tests and choosing wisely, not just doing the same ones all the time. And that really leads me to the second biggest developmental thing as a professional that I did. So when I was studying my master's, I was in one of the hospitals, and the head of that department pulled me in after the first week of being there and turned me around and said, "Stop fixing people." They just said, "You are not learning anything. All you're doing is you're doing what you know works." They said, "I want you to stop doing everything you know works, and I want you to try everything you don't think works." They said, "Because all these patients are actually here for your practice. That's your job." And that changed the way I do everything from even to today. I still test things I don't believe should change, because now I learn things pretty much all the time about challenging my beliefs. And by challenging my beliefs, I create a better outcome. I create better thought processes. I find things that perhaps I didn't understand, but now I better go and understand. So that's another thing. If you want to develop professionally, challenge yourself. Don't just get away with what you're good at.
It's so true. We had that comment when I think I was training the other day. I said it to you, Louie, and I kept missing one of my Olympic lifts. And then, no, it was to you, Dennis, and I was like, you learn more from failure, because I was like looking at the movement, I was seeing what was happening, I was kind of analysing everything, my form, my technique, and it's always like when everything's going smoothly, yeah, I'm improving and I know my methods are working, but it's more those times when I failed that I've truly learned what it is that I'm doing wrong, right? And it's like, I have that feeling like right now, every now and then I go into the pit of despair where I'm just questioning everything. Well, I did that the other week, and I was just like,
You're still there, aren't you?
I'm still there, I'm there. The anxiety of not knowing everything, and I'm like, but that's good, as long as I'm always there, and I'm knowing, I'm challenging myself and I'm continuing doing it. It's a good feeling to know that, because if you think you know it, then it's a dangerous place.
Yeah, I think, and even as like a coach, you have your go-to things that you're going to give people that you know and you've tested over a decent period of time that work. But I think just sticking to those all the time and not trying new things, you're kind of limiting yourself, especially in the sense of we know how variable people are. And you might get that person one day where those things don't work for. And if you don't have anything you can pull from elsewhere and employ, well, you're no help to them any longer.
Mm-hmm.
So beautiful, isn't it? You have to have had those mistakes to try and figure out a way around them. Always base your concrete self in your successes, because when you do start to question yourself, also realize that you've got a lot there that you do know that is successful, and that's always there. So yes, you do go through those moments where you might go a little bit deeper into your, maybe I'm not that good and maybe I get things wrong more often. Then you've got to sit back and say, actually, I'm actually pretty good. I have a lot of success. Don't let that shake you too far. Just use it.
I like it. Use the stress.
Are you okay?
I'm okay.
I'll just segue into something else a little bit deeper. I'd like to hear it from you. A lot of times I hear this thing, right? So say we're working with a powerlifter who has a pretty large total, say a total exceeding 1,000 kilograms, right? That means that they're very strong, right? And then we're doing drills before they train, such as, say, the base 5, which is primarily a lot of booty band sort of stuff, okay? Which is fine. Now, a lot of people will say that, like, you know, this person being at this sort of elite level, right, has a stimulus that is so far greater than a booty band, and then they start to discredit the booty band work or that little system that you have created, say, for example, as the warm-up or activation. What is your take on that?
All the biggest people in the world I know do the base 5. All the most successful, all the most successful ones do.
Yeah.
But you almost got a little bit there, which was good. You made the delightful correlation and perhaps the relationship between warm-up and activation. They're two very different things.
Yeah.
Don't confuse them. So the activation is simply stimulating the pattern, or stimulating essentially, realistically, the muscle group that you're wishing to implement into the warm-up. So you might notice somebody, for example, does have a lack of hip torque, but a very strong back. That's nice. They could improve if they improve their hip torque, their hip rotation ability. So you're going to start with a movement that pretty much isolates that, and then you're going to stick it into the pattern. And that's what we do. And if a person happens to have a little bit of impingement quite consistently, you're just going to do your activation work, so you're setting them into a position where they move better. So it's always just a preparation, it's not the warm-up. These are the basic things. It is amazing how many, so we say very close to 1,000 kilo lifters there are, who I've met who can't do a side plank when they have a problem. Good, we just found they don't have frontal plane ability. So remember, most of our lifts are very sagittal, forward-backward plane. And we get very, very good at our forward-backward plane movement, powerlifting's like that. But when the failures come, we suddenly find we are actually needing to strut and brace that person up in the frontal plane. So you suddenly got your side plank that has to be involved. And then we can progress those things. And of course, once you add glute medius and your obliques and you add your QL, your sagittal plane improves again. That's the value of your activations.
Which is why you prioritize active. I think, correct me if I'm wrong, you go activate and then warm up? Or you go activate and then mobilize? What was your little sequence there before?
Oh, that was very nice. For your general person who doesn't display a lack of mobility, it's activate, mobilize, warm up, then train. For the person who has mobility issues, just flip it. It becomes mobility prioritized, then activation, then warm up, then train. Prioritize the problem. If there is no problem, activate first.
Context is everything.
What if there's no need to activate?
You must not be breathing. Someone's actually probably reading your eulogy.
The Reverend's out again.
Has spoken. But no, seriously, like say someone's doesn't have, they have no issues. They have no pain. They're good. They're fine. Do they need to still do the activation? Or can they go straight into the warm-up, straight into the working sets? Do you see where I'm going?
Yes, I've never seen an athlete who could do that. That survived.
Yeah. Yep.
I use myself as a prime example of that. Yeah, I've been happy to warm up on 140 kilos on a bench press for 10 reps. Damn stupid thing to do.
Yeah.
Okay, how often do you last doing that? We've all done it theoretically at some point, and then we've not done it because we suddenly realized that there was value to going to the movement pattern. So most of the bigger people I deal with, I would expect they would do 1 hour of activation and mobility, perhaps even before they hit the warm-up bar. The most, I say, when I really look at it, the bigger people who do come to me are usually the most dysfunctional when they come to me, because they're very resilient to dysfunction. They don't realize they're dysfunctional until they can't wipe their ass. And their wife refuses to do it for them. Then they've got a problem. So they come to me and they're very dysfunctional. We treat the dysfunctions and they continue on their merry way.
If we talk about powerlifters and we just say that they're quite dysfunctional, that is obviously a very generalised statement.
You are dysfunctional.
And we're talking about context here. What are some of the dysfunctions that you do see? Is it just frontal plane competencies that just don't exist? Or
and a lot of, for example, shoulders will probably be the biggest thing we're going to have a problem with there. Because we are really just moving a large weight in a single press, which lying on our back on a board is not really the most fundamentally functional movement pattern a human being involves.
Yeah.
And as a result, you tend to become, if you look at a lot of people who bench press a lot, they tend to be very protected in the shoulders. They tend to be forward in head position quite a bit. And they tend to come in with the anterior shoulder pain. Now, you try and get them to reach behind their back, they can't reach their back pocket. And that can be useful when it comes to paying the bill at the restaurant, but it's not much useful at other times. So we do find we have to improve those dysfunctions to remove their pain.
Interesting. I like it.
Oh, really?
And it is and human beings are so interesting. You look at someone like Bill Kazmaier, who tore his pec at the world's strongest man. Yet then he set 2 world records probably on the same day with a freaking torn pec and a seriously torn pec. Deadlifted some ridiculous amount of weight. He did a squat as well that beat everyone else. How many people do you know who can do that? Well, this is the sort of level of some of the athletes that you'll tend to deal with some days. They exist and perform in ways that no one else is going to. And that's the individual thing too. There are other people who are just so delicate, and the slightest thing they have a problem with. And that's the variations within human beings. We are all a little bit different, and part of that's also the neurology and the central nervous system. People have had great trauma in their lives can sometimes be very sensitive people. They have, very heightened pain awarenesses. So it's a case-by-case analysis. Every individual. There's no rule that says everybody has to be identical. And of course, we're all not identical. So to chase the idea that now everybody has to do this, everybody has to do that, have all these ranges and things, no, I think that's not understanding the individual, because many people have deep hip sockets. They can't go ass to grass in a squat. They can't even go ass to chair in a squat without having to do lumbar spine flexion. So we've got to accommodate that different people move differently, but the principles of movement remain the same.
Do you believe that we're moving away from, manual therapy and using movement instead to treat a lot of these things? Or are we still stuck potentially with manual therapy? Or do you think there's a place for it?
Oh, shit, there's always a place for manual therapy, no doubt at all. Absolutely a place for many different therapies. We're just getting better at applying movement solutions now, that's all. We're getting more professionals who are getting good at it. That's what is happening, is you're getting professionals now who may have only been given options of manual therapy and now are learning toolkits of movement interventions and exercise interventions. It's a wonderful thing. We're just getting better, unless you get stuck in the there is no evidence of anything, I just graduated, I know everything.
I like that. I really like that.
Yeah, cool. I like it. All right.
Yeah, we have so much to be grateful for. There's so many wonderful people out there. Professor Stuart McGill, over 300 published papers on spinal work, and then you get people who disrespect him who have never actually theoretically been able to analyse one of his 350 papers, but somebody else told them about it. That's the problem that we get. We do, as we always say, we only see further because we stand on the shoulders of giants. And if you hack down your giants, all you're going to be doing is you're going to be back down in the grass. These giants are there for a reason. They built their work on other giants, and they always acknowledge it. And I always acknowledge the greats who have been before me. Robin McKenzie's wonderful work, Professor McGill's work. I love Pavel Tsatsouline. I like what he brought forwards. There's a lot of good educators out there. We don't always get everything right. But because there's one little thing that you might disagree with, that doesn't mean the rest of the work's wrong.
Yeah, we always go back to it. We're all doing this. We'd like to hope and think it's to help people, right? It's not to tear people down. But we sometimes need to remind us, and this is a good conversation, that's why we enjoy this stuff. Over the last year and a half, 2 years, we've developed the most we've ever. It's because we've had the privilege of, talking to yourselves and other people who have given us the time and the opportunity to bring us up as opposed to tear us down. But thank you for that.
That's what it's about, isn't it? We're all on the same journey, at least us who are moving forward to help people. And we are finding reasons to help people, not reasons to say why we're not successful. And I do find a lot of the negative people out there are just simply explaining realistically why they're not very good at what they do. And they're angry at people who are good at what they do. And you're not allowed to be better than them. They just tend to get that problem. They could just stop and start to understand our context of how we perform.
Mm-hmm.
That's what it's about.
Do you follow many people on social media?
I mean, people I like, I tick the word follow.
Are there some names that you think are doing some good stuff out there at the moment?
Sure, I just love what Sebastian Oreb always does. I think his work's outstanding. I love Matt Wenning's work. Matt Wenning is a brilliant educator. Just follow Matt Wenning's work. He's great. Mm-hmm. He's got all the science and all the work behind him. I love Professor McGill's work. He's not so much on social media himself, but there's the Backfit Pro is a great place. I love Ben Lustig's work at Moreland. Danny Antonellis, who works with me, she's really super to have. Shant at Strength Revolution. Man, he's got so much to give, and I love what he does. So, yeah, look, there's others who are Joel in London, Joel Proskowitz, really good on back work. Here's a guy who's had back surgery himself, and if you want to know about the experience of back surgery, Joel's fantastic. He's coming out to Australia later this year. He'll be teaching the McGill course. Yeah, there's some really, really good people out there. And I love pale horse powerlifting. I love what Reese does. I love his approach to sometimes being a little bit confrontational, sort of say.
Yes, a little bit.
Chris Duffin, Mad Scientist Chris Duffin, Squat University. These are all the good ones. And someone said to me at Scott University how they didn't like something he posted. I said, look, if I posted as much content as he did, and it was me, I'd probably disagree with some of the shit that I put up. It's just so much of it. I'd probably find a problem with something I say. Yeah.
It's the volume game, yeah.
Yeah, nice.
So they are the good ones. Now, if you're following those, you probably haven't got much time to work. So that's why I don't really read many people's work.
Yeah.
I just have to read the studies that are coming out. I've got a lot of subscriptions to journals that I quickly read and download and then integrate into the work. So pretty much I'm more looking at the science side of the world than the social media world.
Mm-hmm. Yeah.
Do you reckon, because this is one of my things I always think, and I have to put my TV away sometimes and put it in a box, because I think that, we're so distracted these days with our phones, Instagram. You've just got so much things that we've almost lost the ability to kind of focus and hone in on a topic. Do you think that's like a thing, or am I just making excuses?
No, you nailed it. Well said. We just noticed the other day, my girl and myself, Julie, we probably haven't turned the TV on over the last month. And it was just like, shit, we just haven't turned it on. It's just sitting there. No, our lives are too busy to be mindlessly, shall we say, engaged. And sometimes mindless engagement is useful. You're looking for that time out. It's cool. It's just suddenly we hit a spot where the last month it's been better to be quiet at the end of the day and just doing some work. Always things to catch up on. But I'm sure, I'll get back to catching up on some series that I haven't seen for a while. Everything has its time and place, and it's nice to say I'm happily out of balance in life at the moment, just eating, training, studying and working.
Yeah, very out of balance.
I
Sounds
love
like the
it.
most balanced life ever. I'm happy with that. What kind of shows do you like watching? You look like a Sons of Anarchy type of dude.
Oh, man, it's hard to say. I mean, seriously, the last thing I was looking at, I read the comic book called Preacher. And if you ever read that, it's a great series. Preachers has a couple of seasons of that. That's not bad. It's not exactly like the comic, but it's entertaining enough. Got enough gore to keep me attracted to it.
I like it.
What about yourselves? What do you tend to get up to?
Oh my God. What you just said at the very end there, it's like, work, train, eat, and a little bit more work, which is fine. But, although that might sound like we're complaining about it, we're really not. It's at that point now where we understand that we're quite busy and we have to continue being a little bit busier in order to do what we want to do, right? So
It's not work though.
It doesn't feel like work.
I've
That's
worked
right.
before. This doesn't feel like work.
Yeah, I know. You're like, well, I call it
fun.
work, but yeah.
Yes, you're no longer working for a living. You're just living. You're living your life. You're living your best life. That's pretty much what it is.
Yeah,
That's it.
And it's a good place to be.
Absolutely. Is there a book? That you've read in your lifetime that you think has made a profound change?
One that made a profound change is actually more. It was more a paragraph out of a Sports Illustrated once. That was a reporter went to see Magic Johnson when he had a knee surgery. And the reporters said how he's walking in the day of the surgery and expecting to see Magic sitting there in a room with people and being all unhappy and shit. He walked in there, he was Magic Johnson sitting in the bed, laughing, smiling, cracking jokes to people around him. And the reporter said to him, I just don't get it. You're just so happy. You just had surgery. And he goes, well, I realize that people don't like being around sad people. I realize that people don't want to hear down stories. People like to be around happy people. And that was a communication key. I thought, when you're working with people, people really want to be around people who are happy doing what they're doing, not unhappy about what they're doing. And that probably struck a chord when I was about 13. There you are. And that's always remained primary is, people ask me how I'm going. Freaking awesome. How else would I be? And it's pretty true. Now it's developed to the point where that is truly the response. So you do tend to mark yourself on that. And after that, it was probably, if you want interesting books, something like Fear and Loathing in Las Vegas by Hunter Thompson. Why? Because it makes you think a little bit differently outside the box. It throws curveballs at you. And I like work that's a little bit, that once again was an authentic book. It was an original book and something once again that starts you there. And I'll always go back, there's no problem reading the Bible. You don't have to believe everything that's there, but there's some wisdom out there that's, it's 3,000 years old. And shit, you suddenly realize it and you go, someone saw my problem a long time ago and it's not really new. There's a great old Jewish saying which says, if not now, when? And that's in regard to a task. Isn't that?
That's productive 101. I love that. If I want to run. Oh man, that's a great place.
Yeah.
And that's it. And suddenly you realise there is wisdom out there that we can attach ourselves to, and it doesn't have to be that you've got to be stuck on the stories themselves. But people have written some stuff for good education a long time ago.
All right.
Yeah.
On that, I think we'll be going for some time now. I think we'll start to wrap it up. But you're saying you got some stuff going on education-wise, seminars. Where can our listeners find you? What's going on in your life? Take it away.
All right. There will be definitely a 2-day lumbar spine course. It's really a 4-day lumbar spine course. So I'm actually just putting the first 2 parts together. And if you can do the first 2 parts, the first 2 days, then you'll have all the tools to understand how I assess and get to where I get to, and the science behind it. So the first one's going to be in Perth in late May. And then I'll do June and July, and we'll figure out Melbourne, Sydney, Brisbane. And of course, with Australian strength coach Sebastian Orrid, we'll be doing our 3-lift seminar series again. And with Danny Antonellis, we'll be doing our glute series again. And that will probably wrap up the year when I put all those together. So it'll be the first 2 parts of the 4-day lumbar spine series will be done this year. And then we'll probably do the 2 and the 4 into next year. And by then we'll be off to the States as well, because my dear daughter competes in Jiu-Jitsu in the World Championships in 2023, which is where she should be again. We'll all head over together, and perhaps I'll stay for a few months in the States and go see all my good friends over there.
Are you taking us with you? Is that what you're saying?
We will
Get close.
We will be free.
That's awesome. That's awesome.
Nah.
Yeah.
Hopefully she dominates.
Awesome. Yeah.
Always does, yes. She once again has a really good understanding. When she was a kid, she was a very, very bad loser. And that was one of the lessons I taught her. Stay being a bad loser. Because good losers become losers. So stay hating losing. Hate it.
100%. This is
Become a bad loser.
Yeah, this is my story. This is my story. My dad, when I used to lose soccer, he'd take me to the he'd probably get reported for this now, but he taught me well not to lose. When we'd lose a match, he would take me to the park and he'd make me run laps. And every time I came across, he would be like, "How does it feel to lose now?" And I always remember that I do not want to lose. But no,
What a wonderful father.
I love him for that. Yeah. Awesome.
Thanks for coming
Especially
on,
when
Andrew.
it was the other guy's fault.
Awesome, man.
All right, great to catch up with you guys. And I look forward to catching up again whenever we can. Train hard, stay big. It's what we do, isn't it? Live big.
That's it.
100%.
Thanks so much, man.
Thank you for your
Appreciate
time,
it.
Andrew. Appreciate it.
Catch you out there.
Thanks.